Everyone. We are glad to see you or just to hear you. We are glad that you have joined the webinar. This is one of the next webinar in the series of project with international experts, with international institutions, international business schools, which Academy DTEK has launched when the war started. And the goal of this project is to find the best minds, to find the best ideas, to find the best solutions, and to gather all the help from all over the world to help Ukraine in this crisis situation, to help in terms of anti-stress and to help in terms of anti-crisis as well. Before we introduce the topic, before we say a few words about a well-known partner which we have today and our speakers, I wanted to check the connection, whether you hear us in a good way, whether you can see us. Please use the chat and put plus just to let us know that you hear us and you see us. If you're listening us in Zoom, do it in Zoom. If you are listening us at Facebook, do it at Facebook, please. While you are doing, I wanted to mention that you may join us in different channels. So some people may join us at Zoom, and Zoom there is the possibility to choose the translation. So you may listen to us in the language of the original, or you may choose the Ukrainian synchronous translation. At the very bottom of the panel, there is the globe. Just choose the language, English or Ukrainian. If you're listening us at Facebook, so this time you will listen to the synchronous Ukrainian translation, and tomorrow there will be the recording of the English version as well. So some technical questions. I see the pluses in the chat that some people have already joined us. So we hope that more people will join soon. Meanwhile, let me introduce our well-known partner. So this is Stanford University, Stanford Medicine, or otherwise the department of the Stanford University which deals with health education. And here we have the representative Artie Porval. So let me just express our gratitude on behalf of the Academy DTEK and the whole Ukraine for being so responsive to us, that you have agreed to join this project, that you have agreed to share knowledge, and that you have managed to find the best experts who will help us to find the answers to the difficult questions. We have discussed many times many questions connected with the stress that we encounter and with the ways to deal with the stress. We were discussing the feelings which we're having and the ways how to deal with this feeling. This is anger, this is tiredness, this is aggression, guilt, exhaustion, frustration, and many other feelings. And recently, when we were discussing the topic of this meeting with the colleagues from Stanford, I have mentioned that every time when we come to the discussion of the topic, we have different feelings and different problems. So if we addressed the business schools a month ago, there were other challenges. If we're addressing them now, there are new challenges. And I'm sure in a month, there will be also new challenges. And what have they shown me? I was like completely surprised because it looked like, well, everything that I feel they have on the slide. And I had the feeling that they have prepared it on the spot. But actually, we have to acknowledge that unfortunately, Ukraine is not the first country overcoming such a situation. There were many other countries, and there is experience, and there are people who are helping other countries, and they can help us as well in this situation. So today, with this conversation with the faculty from Stanford University, we will discuss what managers and leaders can do to foster a culture of resilience in this time of war. With the harsh reality of Russian-Ukrainian war, you may be grappling with what to do now, how to support your team, how to support your family, especially when you also be experiencing this strange feelings of exhaustion, fear, guilt, or anger. With the expertise in trauma and post-traumatic recovery, Stanford faculty will share information about what employees may be experiencing and what has been found to be helpful in promoting natural recovery. So we will talk about acute trauma and post-traumatic recovery. We will talk about how to build and foster a culture of resilience. We will discuss a little bit leadership in the time of the war, how to maintain empathy and balance. We will touch a little how to cope with stress and uncertainty, and what does this recovery look like? How shall we know that we have recovered? Let me introduce our experts. This is Dr. Daryn Reicherter. So he's a clinical professor, psychiatry and behavioral science from Stanford University. Dr. Reichter is the director of the Human Rights in Trauma Mental Health program at Stanford University. He is one on the list of experts for the extraordinary chambers in courts of Cambodia and at the United Nations International Criminal Court for this work in international trauma mental health. As a fellow of Stanford University Center for Innovations in Global Health, Dr. Reicherter has created new clinical rotations for residency and medical schools education in local community clinics, as well as opportunities for residents, medical students, and undergraduate education in global trauma mental health. And our second speaker, this is Dr. Debra Kaysen. So she is a professor in the Department of Psychiatry and Behavioral Science at Stanford University and a licensed clinical psychologist. Her research focuses on treatment of mental health concerns following trauma exposure, including PTSD, depression, and substance abuse. So she conducted clinical research adapting treatment for PTSD, yes, for use in low and middle resource settings, including Iraq and Democratic Republic of Congo. So she's a trainer in cognitive processing therapy and has conducted trials on CPT, written exposure therapy, relapse prevention, narrative exposure therapy, motivational enhancement therapies, and many, many other things. So I can continue representing our speakers, but it takes a lot of time. I think that they will add what they think is necessary. But what is important that I want to emphasize that here are the people who know what to do, who had been on this way, helping other people, and we are sure that they will give us good pieces of advice to have the possibility to overcome and to deal with the situation which we are encountering now. So Debra, Daryn, the floor is yours.
Thank you very much. Debra and I talked yesterday, and we decided that I'd kind of kick it off and then hand it over to her. And you know, I was writing my notes for what to say in this conversation, and I think that the thing that I want to start with, and we're going to just keep coming back to this over and over in our talk, is the usual outcome of a traumatic event is well-being and good mental health, the usual outcome. And then there are some risk factors in some settings where that can get pushed to a limit that then is something that becomes clinical concern. But I want to be really clear. I think that the most of the folks that are in our audience today are not going to get to the level of clinical concern. And this is a really important idea, because I think a conversation like this, Debra and I, the mental health professionals, could really scare people by saying, hey, like a lot of times trauma results in long-term chronic mental health issues. In my area of work, I end up seeing the folks that do have chronic issues, but I've got to say, that's a fraction of the folks that are out there. And I do work in very, very intense areas. I'm a consultant to the United Nations, working on the investigation of ISIS in Iraq. So you can imagine the folks that are potential witnesses for that investigation have been through years of incredible trauma, and also the persons that have had the most, the worst outcomes are selected, and the ones that I see. And I think that's just a really important way for us to start off, because I think otherwise people say, look, a psychologist and a psychiatrist are going to talk to me about what's happening, to me and to my psychology. That's bad news. I don't want to see a psychiatrist and psychologist. That means there's something wrong with me. And I think, Debra and I really want to drive home this message. What's happening to most folks is very, very normal. as mental health professionals that think about trauma, we expect a reaction when people go through a important stressor or a traumatic event. In fact, it would almost be concerning if people had no reaction to stress and trauma. But I've got to say up front, the most usual outcome is resolution of unwanted symptoms. Now, having said that, there's things that make it more or less likely that the psychological part is going to be problematic going forward. And that's kind of one of the things that we want to cover today. So maybe, Debra, if you wouldn't mind putting the slides up, I'll just, I'm going to go off of my colleague's slides to start with here, and talk a little bit about some of the things that put us at risk for having ongoing or worse outcomes, and some of the things that are protective factors or resilience factors and make it less likely that we would have unwanted outcomes. You got them, Debra?
We're having some technical problems with screen sharing. I'm not quite sure why, so I'm trying to fix it on my end. Sorry, Daryn.
No worries. Okay, so while we're waiting for him, I actually don't need the slides so much. I can talk a little bit.
We got
about
it.
Well, there we go.
There you go.
Yeah, and so the first slide is kind of looking at some of the early stress reactions that we see when people have been through a traumatic event. And some of these might really resonate with our audience today. Intrusive reactions that would mean, having your mind is sort of stuck on some of the traumatic events. You kind of replay them over and over in your head. You're ruminating on them, thinking about them much more than you would like to. Or even, things pop up in dreams, in the form of nightmares sometimes, or in the form of a dream. You kind of, reimagining or re-seeing something traumatic or something very stressful. The other common, you can see them on the slide. I'm just going to go through them. Avoidance, but just I don't want to talk about it. I don't want to think about it. Or avoiding places, smells, things that might bring back a memory of a traumatic event. Physical arousal, I think that's pretty common, and a lot of you might resonate with that, where you're just sort of like uptight. Your heart is beating fast. Every little thing annoys you or makes you startled, and you say, "That's not how I used to be. I don't like this a bit." Really get agitated easily. Grief. It can, I think grief for a lot of things. Right here on our slide, we said, response to the death of a loved one. But I mean, there's grief over, loss of property, loss of your personal space, and when people have to move, there's grief over. I mean, in this case, I think there's grief for the loss of peace and stability that was once enjoyed. And then some mood symptoms, feeling fatigued, feeling low mood, feeling what we call anhedonia, just not really able to have the same kind of pleasure reactions that you usually would have, just because this is weighing on you so much. And physical reactions, and I kind of put physical reactions with the arousal. But yeah, I mean, like stomach aches, headaches that don't really make sense and don't really have a physiological cause. Now, all of that is something I would just refer to as completely normal. Again, even if somebody has a small stress reaction, a small car accident, we can see some of these things, right? If somebody has a more major traumatic stressor, we psychiatrists, psychologists expect to see some of these things. So let me tell you what I'm talking about. The risk of having these kinds of symptoms develop is a balance of protective factors that can make these less likely to happen and less likely to persist. And then risk factors that would make them more likely to happen or more likely to persist. And they're very straightforward. The risk factors include, how intense was the trauma? How bad was it? Was it witnessing a car accident or being in a car accident? Was it being in a car accident or being in a car accident where a loved one was killed, right? These are like grades of intensity of a traumatic event. And you can imagine, car accident could be very minor, or it could be, life-changing and major. You could be almost killed or lose family members in the car accident. Intensity, frequency. Well, how much did it happen? Was it one day you had a car accident, or is it, something that's a stressor that's happening over a period of time, where it's a stressor happening over and over and over again? And then, of course, duration is another factor. Some of the clients that I work with who are refugees, or have been involved in some of the more heinous crimes, the other thing that's really scary for us working with them, is that they've been in a trauma situation over the course of years, not just a single event, and that's another risk factor for these things happening. So I'm telling you all the bad news first. Now, kind of talk about the good news. Some of the good news here is there are protective factors, and protective factors are super important. And also, a lot of times we can manipulate protective factors for resilience, and that's what my colleague's going to talk a little bit more about. Protective factors sort of include community, family, having a safe place that you can go to after the traumatic event. They include sharing reactions, using your empathy with folks around you. They include things like, is your family intact? Can you have safety? And I know that the protective factors are going to be something interesting for this conversation, because some of them are present and some of them are unknown and some of them are absent. But, at the end of this, I think one of the things that our message is going to be is, really, if you can think about the protective factors in your life and gather them together and use them, then that is a very important tool toward resilience. Debra, do you want to go forward with the slides? Is it stuck? Oh, here we go. Yeah. And so what Debra's putting together here is sort of a timeline that all of the trauma mental health folks are very aware of. And in the first hours, the first days after a traumatic experience, it's really about stabilization and putting some of those protective factors in place. Example that I sometimes talk about, just to make the point, is in the United States we had the tragic events of 9/11. The World Trade Center was destroyed, and and if you can imagine somebody who experienced that event and obviously had all those risk factors I just talked about, a very intense traumatic experience, but it was a single event. And then if you can imagine two different individuals, and one individual is able to return to their home across from Manhattan in a safe neighborhood, their families around them, they still have their job, they still have their wife and children, and maybe some of their extended family and community comes around them to support them. And then if you can imagine somebody else, hypothetical person who goes through the same experience, but in the event their wife was killed, in the event they lost their financial stability because their job was tied to the World Trade Center, and they don't have a place to go, they don't have a community or a family, right? The likelihood of, the person with no resilience factors developing symptoms or getting worse is higher than, the likelihood of the person with the community. And, again, that's what we really want to argue is during the, the second phase of this, where we're saying building resilience, that's when you are really trying to get in a safe place where you're not exposed to the trauma directly, and you're trying to put together these resilience factors so that you can move into what we're calling here the recovery phase. But it's quite natural, even with all of those resilience factors, for someone to have these symptoms that we showed in the beginning. And then what we're hoping happens, and what we see happen very, very often, is those symptoms resolve themselves. They go away. And again, I can't say it enough. It's normal. It's normal across cultures. It's normal across genders. It's normal across ages. And quite frankly, it's normal across mammals. When we look at primates or dogs and cats or mice that are, exposed to traumatic events, it's a normal process for mammals on this planet to have unusual behaviors, unusual thoughts, etc. We see it in all kinds. One of the questions that always comes up when I do my work that's international or cross-cultural is, well, is it true that the Cambodian folks are going to have the same kinds of reaction, or that the Bosnian folks are going to have the same kind of reactions? And the answer is almost always yes. We're human beings and we have these reactions to trauma, but we also expect them to fade with the right resilience plan. And in most cases, they're gonna dampen down and improve. I don't want to overstep my time. So what I want to do is just say, really what, the message that I want to bring home to you is you just, you understand what the risk factors are, and they're going to be there. This, in the situation in Ukraine, it seems like there's going to be stressor ongoing. But you also understand what some of these resilience factors are, and you just want to make the balance go in your favor, right? And that is something that you have agency over, and that you can do in order to, really address the stress that is upon you. But this is the moment where I'm going to turn it over to you, Debra, and Debra's going to talk about her slides, but basically take what I've said and then go toward, so what do we do? What's a recovery look like? How do we not have these symptoms and move forward?
Lovely. Thank you so much for that, Daryn. So just to segue into what do we do? For many of the people right now, people are in this period of days to weeks post-trauma. Now, the trauma I know is ongoing, but people are still in that natural recovery phase. And what I'm going to be focusing on are specific skills that can help build resilience, talking about the importance of social support, coping, not going too far around reactions that people may be having, and getting out and going and doing things. So I noticed that you all had a number of questions in advance of this about what is resilience? What does that mean? Really, stress is a condition that people have when they perceive that the demands being placed upon them exceed their resources and they can't mobilize. And stress isn't always bad. Lots of things are stressful, including good things. What resilience is, it's the ability to be able to adapt in the face of those stressors. And it's actually quite common. We talk about people who are resilient as if they are extraordinary. But as Daryn was talking about, resilience is the norm. Most organisms adapt in the face of stress. It also doesn't mean that you're not in pain and that you're not suffering. In fact, when we look at populations that have been resilient, they often are in distress, but they're able to regrow afterwards. In addition, resilience isn't a trait. It's not that you're either resilient or you're not resilient. It's something that can be learned and built and acquired. And I'm going to talk a little bit about some strategies that you can personally use or that you can support your teams in using that can help build resilience. The other piece is that it's not one size fits all. So people follow different pathways. They may rely on different strategies, and you may have ups and downs based on your level of stressors in how you are being resilient and your symptoms and your functioning. I'm going to skip this. So in that acute phase that Daryn was talking about, your first goal is to just enhance safety. And I would imagine that from all of you, you're in different places in terms of your current safety, and your team members may be in different places in terms of their safety. If somebody is an immediate risk, your goal is to help establish safety for them or for yourself, right? And then to enhance ongoing safety, maybe getting somebody out of a dangerous situation, perhaps a combat area or bombing. It may be helping people take care of immediate needs. And then it's helping with physical comfort and emotional comfort. And the goal is to help calm and orient people who are emotionally overwhelmed. Now, I also wanted to talk about acute grief. Grief isn't a psychiatric diagnosis. Grief is a normal response to loss. And during war, often grief processes, rituals, and our social supports are interrupted. If people have had to leave their communities, they can't engage that community for support in the way that typically helps with grief. If you or team members are dealing with grief, either around loss of loved ones, or as Daryn was talking about, grieving normalcy, grieving peace, grieving your old routine and life, it's really important to give yourself space to have those emotions, to notice the departures that have had to occur in terms of your religious or spiritual rituals, a loved one's wishes. There may be a time where you can't go to someone where you would want to normally with a loss because of the war. And then identifying achievable rituals and ways to engage current supports and comfort. And sometimes this may need to use virtual supports, like the incredible technology that's allowing us all to talk today, when we can't be with people physically. Now, I also want to talk about a strategy that can be helpful for you and for team members who are feeling really overwhelmed. Sometimes it may be around issues around comfort and safety. It could be about immediate problems. When people are in this acute phase, sometimes our problem solving isn't at its best, and that makes sense. One thing that you can do or support team members in doing is to break big problems down into much smaller, more manageable steps. So helping a person focus on what's the biggest problem right now that they need to address, taking it into small pieces, talking about the pros and cons of different solutions, and then coming up with a detailed plan for how to put that solution into action. This may be issues around housing, around what to do about work, what to do with their own family members, but it helps big problems turn into much smaller, more manageable problems. Now, I want to return to social support. Daryn talked about this. You're going to hear me talk about this. That is because social connections and support are one of the most powerful factors in building resilience. It fosters well-being and recovery. And especially if people have been displaced, those supports in community often are disrupted. It's helpful to think about social support as something that has many facets. And it is helpful to think about what type of support someone may want or need, what type of support might be easiest to ask for, and then to identify the type of support that might be most helpful in the current moment. So it can be things like material or physical assistance. I need someone to watch my kids. I need help getting food or housing. It can also include things like emotional support or that feeling of social connection, just being with people, which was already disrupted by the pandemic and now has been disrupted by the war. Sometimes it's feeling needed, and the idea of building social support by giving is actually a really helpful one to acknowledge. We feel better about ourselves when we are taking care of others. I would say to be careful about that one and having it in balance. Those of us who tend to naturally be givers, healthcare providers fall into this category sometimes. Sometimes we cope by taking care of others, and we forget to also accept help ourselves. And so it's about keeping that in balance. That may be true for you as team leaders as well, making sure that you're getting the support you need so that you can also give support to your team and the other people that rely on you. When you think about how to promote social support for you and your team, what you want to do is think about enhancing access to people's family, friends, and loved ones. Now this, and their community resources. Now this may take some thinking, again, because these supports have been, in some cases, highly disrupted. And so encouraging creative problem solving about how to reconnect with those community resources and those loved ones, even during times of crisis. And then to encourage and build new connections with immediately available support. And this is especially important after losses and separation. Now, contact doesn't have to be physical. Could be email, could be phone, could be social media if in person is difficult. I would say with social media, encourage active social media engagement, not passive social media engagement. Scrolling through Facebook is not good for anyone's mental health and is not good for building resilience. Okay, so it's really about that active connection with others. Now, as Daryn said, I do want to highlight that all of these reactions that we're talking about are common, they're normal, and they're absolutely understandable. If you or someone in your team is out of the immediate crisis, so you're safe, and these kinds of reactions are continuing or are worsening or are getting in the way of your functioning, then it may be time to think about adding in more supports or reaching out for help. Now, Daryn talked about those trauma reactions earlier, those very common reactions. And there are some things that you can do that can help make these more manageable for you or your team members. So trauma reminders are things that evoke thoughts or feelings related to the event. It could be a sound, could be a smell, it could be a time of day or a situation or an image on the television. And knowing that you may have these kinds of reactions can help you plan for coping for them, so you're not surprised. So for example, if I know a loud noise is going to cause me to have more anxiety, what I can do is I can plan to use, for example, breathing strategies to manage that physiological response. The other thing I can do is remind myself that these reactions are normal and are expected, rather than getting distressed that I'm having distress. And that can in and of itself build resilience and protect you from having more long-term responses. Now, the other piece that I've started talking about are coping strategies. When people are distressed, believing that you can cope helps build resilience. And one way to believe that you can cope is to think about what you've done in the past to cope with hard situations and to go through what typically works for me. Are these things that are working for you now? Have you tried using them now? Sometimes it's hard if you're in a new situation to figure out how to engage those coping strategies. But start with those. And if you need to, adapt them, right? Exercise is a great coping strategy, but I can't in this neighborhood, I can't in this situation. Can I exercise in my home, right? Rather than going for a walk or a run. So thinking about how to adapt them if you need to. Now, sometimes you need to add in new coping strategies. Maybe the old ones aren't accessible, or maybe you can't use them, or maybe they're not effective. These are some examples of strategies that can be helpful. These are not one size fits all. These are examples you could bring to your team. These are ones you can try for yourself. The point is, try them, see if they work. If they don't work, try something else. So persistence. So it includes things like talking to other people, positive distraction. So that could be talking on the phone. It could be maybe playing a little bit of a computer game, but not too much, everything in moderation, doing Wordle, right? Different kinds of small distracting activities, resting and eating healthy meals, keeping a normal schedule as much as you can, taking regular breaks. This is a really important one for all of you as team leaders. Often we push ourselves very hard, but breaks are important in maintaining resilience. Humor can be helpful. Scheduling pleasant activities, even if they don't seem pleasant in the moment, going out and doing things that have been enjoyable and letting yourself be present during those activities can be quite helpful. Focus on something practical that you can do right now. Using relaxation methods, there are a whole bunch of different relaxation videos on YouTube. It could be breathing, it could be visualization, it could be mindfulness, it could be progressive muscle relaxation. Any of those can be helpful. Engaging in support groups or counseling, if that's available for you. Exercise and journaling can be helpful. Now, anger is a really common response when people have experienced huge losses and disruption. If this is coming up for you or someone on your team, the first thing that can be helpful is to validate it. It absolutely makes sense to be angry given the situation that many of you are coping with. But holding on to anger can be counterproductive. What instead can be helpful is to identify, what do you want to do? What's the goal? What are your values? And then either let go of the anger if it's disruptive, or move the anger towards positive activities. So I am really angry about this. What can I do to make a change? I'm briefly going to talk about sleep because that's so commonly disrupted when people are distressed. These are on paper, simple solutions that can be very hard to implement. But in general, you want to establish a regular sleep schedule. You want to limit daytime naps. So no more than 15 minutes, no napping after 4 p.m. You want to reduce alcohol. Alcohol is common for people who are trying to get to sleep. It does help with getting to sleep, but it disrupts the quality of your sleep and your ability to stay asleep. It's a terrible sleep medication. You want to eliminate afternoon and evening caffeine. You want to increase regular exercise. And then you want to cultivate some relaxation before bedtime by having a regular routine and doing something calming before bed. If you're waking up in the middle of the night or having trouble going to sleep because of worries, what you can do is keep a worry diary where you write down what the worries are. You can't solve those at 2 a.m, so you write it down and you deal with it the next day. I want to talk briefly about strong negative emotions. This is actually my favorite topic and one of my go-to strategies to teach people. So for people who are dealing with guilt, shame, or blame, these emotions can be very common after trauma exposure or when people are very stressed. And what we can use are good questions to help change that belief that's leading to the emotion. So when we're stressed, just like when we're stressed, our bodies can become tight and rigid. When we're stressed, our way of talking to ourselves, our way of thinking can also become very rigid and unyielding. So it could be beliefs about safety. This is a terrible time. I can't keep myself or my family safe. Could be trust. I can't trust my own judgment. I can't trust other people. Control. I can't manage the situation. Blame, something bad happened, it must have been my fault. Or esteem, no one cares about us, the world is unfair. These beliefs are understandable, but they're probably not completely accurate. So when we work on self-talk, the goal is to identify the unhelpful thought, to test the thought, and then to change it to be more flexible. It's kind of like mentally going from being not able to touch your toes to being able to stretch all the way down. That's what we're trying to do with the thoughts. So our thoughts influence our feelings. Angry thoughts lead to angry feelings. Anxious thoughts lead to anxious feelings. Hopeless thoughts lead to hopeless feelings. And calming thoughts help people calm down. And thoughts and feelings are different from one another. So our thoughts are words, sentences, mental pictures that may run through our minds, kind of like a thought bubble in a cartoon. The emotions are the feelings that we have in our bodies when we have a thought. Questioning the unhelpful thoughts can help reduce those negative feelings. And then if you find a new thought, what you want to do is practice it. So these are some questions that you can ask yourself to test the thoughts. What's the evidence that this thought is true? Is there any evidence that this thought isn't completely true? Is there another way to look at the situation that would be less distressing and more helpful? Another strategy is to use a compassionate lens. We're often kinder to others than we are to ourselves. So the trick here is to move that lens towards ourselves. So what would you say to a good friend who was saying this? What would your kindest self say about this? Hindsight bias recognition, that's that what if. That's the places where we go back at decisions we made or things we've done, and we think that we should have done something different. If we had made a different decision, we would have had a different outcome. What's helpful is to ask yourself about what your intent was. Did you know this would be the outcome? What options did you have at the time? Would they have necessarily led to a better outcome? And again, what was your intent? What were you trying to do? Now, with team members, if you have someone who is struggling with these kinds of thoughts, some of these compassionate questions may be helpful to ask them or to show them if they're really struggling. Let me show you a quick example, and then we'll open this up to questions and answers. So if I have the thought, I can't keep my family safe, I'm probably going to feel anxious. I'm probably going to feel despair or sadness. So I could ask myself, is there any evidence that I can't do anything to keep my family safe? Is there another way to look at the situation that would be accurate, but less distressing? I may come up with something that's a little more accurate and flexible. I have specific things that I can do that will be more likely to keep my family safe. Now I might feel a little more hopeful and my anxiety would come down. Now, Daryn and I just had time to give you a small piece of information about what's normal and expected and a little bit of a sample of the kinds of tools that are available. I've included some links for some different resources or tools for all of you to take with you. You can see there's a QR code. You need an app on your phone to read the code, but there's also the links below. The PTSD Coach is an app. It's free. It is in English. I do believe that people are working on translating it into Ukraine. It has screening tools, and it covers some of these same coping skills. This is a link for cognitive behavioral therapy for insomnia. This is a great program if you're having ongoing problems with sleep. And then this last resource is information that was pulled together on war and disaster by the International Society for Traumatic Stress Studies. They have information for helpers and mental health professionals, but they also have information for the general public, including information that's already been translated into Ukrainian. And so these resources are things that I hope will be useful for you. And all of these are free resources and available. So I figured at this point, let's give you a chance to ask us the questions that you all have been carrying with you.
Yeah, I agree. While we're waiting for questions to come in, I'm just going to reiterate, Deborah, that some of the stuff that you said, you know, self-compassion, empathy, these are really, really valuable traits in well-being theory in general, and especially important in post-trauma settings. When we lose compassion because of what we're seeing or, you know, what's happening when we've gone through traumatic events, we really lose a tool for our own well-being and for the well-being of our community. And the other thing that I want to highlight, just as questions are coming in, is, you know, there is this stigma around mental health or around having symptoms. And, you know, obviously Deborah and I don't believe in that. That's why we're chose the profession that we're in, you know, but some people say, you know, look, I'm too tough for this. I'm not going to have the normal reaction. I'm going to not have these reactions. And, you know, I think just reiterating the idea that these are natural reactions and trying to overcome it with toughness rather than with smart strategies, it just doesn't work. It almost never works. In my experience, it never works. And it only makes things worse to not acknowledge it and sort of say, look, this other people that have inferior minds might be, but I'm somehow going to overcome humanity by not having a reaction to this. It almost never seems like a good strategy. And as we went through these slides, you know, we just heard 30, 40 brilliant strategies that actually do work. But I want to just reiterate, this is a normal process, and some of the quick ideas, it doesn't apply to me. I'm not going to get stressed out. I can overcome it. Usually it doesn't work. So I'm going to pause and welcome questions.
Thank you, Deborah. Thank you, Daryn. We have some questions in the chat, and we also have prepared some questions while I have prepared some questions while listening to your presentations. But let's start with those which are in the chat. So the participants are asking, how fast can we deal with anxiety, and is it possible to do fast or not?
I love treating anxiety. You know, I think it depends on whether the anxiety is from a truth threat or a false alarm. And so I separate out fear from anxiety. Fear is a normal, natural response to an immediate threat. If a lion ran into my office, I would be very surprised, but I also would be afraid. I don't need to think about that to have a fear response, and it's adaptive and biological. Right. Now, if I keep worrying for days or weeks about lions, and I won't turn my television on because there might be a lion or a tiger, that's anxiety. In general, for anxiety, some things to think about are to approach if it's a genuine, safe situation. Okay. So depending on what the anxiety is, try not to avoid the cue. Anxiety gets smaller when you approach it and stay with it. The other strategy you can use is to work on the self-talk. What are the thoughts that you're having? And are those realistic? And are those helpful? And then some of the relaxation strategies, breathing, muscle relaxation, can also help with anxiety. Daryn, what do you want to add?
Well, Debra started that by saying she loves to treat it, and I do too. And maybe the reason why we choose this to treat is in part because it's our area of expertise, our area of interest, but also because I think it is something that's treatable. So even when people go into a clinically relevant situation and they need to get help from a mental health professional, anxiety is one of the disorders or the states that we would treat, and people get better. Back to our original point, most of the reactions that the folks in this audience might be having, are probably going to resolve without treatment. But if someone's asking that question, leads me to believe that maybe their anxiety is at a point where they want some intervention. And interventions work, I'm happy to say. There are a lot of different kinds of psychiatric and medical illnesses where the intervention is not so good. Anxiety is one of the kinds of issues that where treatment really is helpful. It really works.
Thank you. Thank you, Debra. Thank you, Daryn. I have another question to you. Well, it looks like naturally some people are more resilient than others. And then we may make the conclusion that resilience is a kind of innate feature of character. Is it partially yes or not? And if yes, then just give your arguments. If not, how much can we develop it? If it looks like naturally I'm more resilient than somebody else or vice versa, can I reach the same level, or there is some limitation which I can reach?
Yeah, I think Debra started to cover that in her slides, and so I'm gonna let you take that one. But I mean, in general, it's probably true that personality types or temperament types have a little bit more or less of a predilection for resilience, but it's just not the big picture. Is we can make decisions, we have agency over our own resilience, and Debra started that with the slides, but I'll turn it over to you.
I absolutely agree with everything you're saying, Daryn. People probably come into the world just like babies come into the world a little more anxious or less anxious. People probably come into the world with more physiological adaptability to stress. And it's like a muscle. You can build it, right? Exercise it, you can build it.
What are the best exercises to build it? Just 1, 2, 3.
I don't know that we know that, Mariana. I would say find the ones that you will do, right? So look at some of those coping ideas. Which can you use? Be connected to people. And that's going to vary from person to person what that looks like. I am extremely extroverted. I need lots of social contact, right? My spouse is an introvert. It only takes a little social contact, right? So it varies for each of us. I would say, look what feeds your heart. Look at what feeds your heart.
And I think in the slideshow there were some really good practical applications. I mean, those are all things that build resilience. If we think about resilience as a magic factor that people either have it or they don't, I think we abandoned that idea and go back to the slides and put those things in your life. And that is the best agency we have over creating resilience in ourselves and in our communities.
And I'm happy to make those slides about the specific tools available for you to translate and to have those be available for people.
Yeah,
so they
thank
can
you.
refer back to those.
Thank you, Debra. You have mentioned that resilience is a kind of muscle which can be trained. Does it mean that the number of stresses we have encountered, that they also make us stronger, and every next stress which is on our way is easier for us to deal with, because like with every next stress our level of resilience also increases, or that's a questionable statement?
Daryn,
you want to take that one first? I have thoughts and data as well.
Well, yeah. So what I would say is, as you build resilient strategies that's adaptive, so that when new stressors come up, you maybe have a way to deal with them better than if you don't build those strategies. But in general, many hits of traumatic stress over a lifetime is not good for resilience. In other words, there are some ideas, a child who has many hits of traumatic experience, maybe they're going to adapt better than a child that has very few. And that doesn't seem to work out that way. It seems more like the more adverse traumatic events that happen, especially in childhood, but it's a predictor for a not good outcome. And so, yeah, you want to avoid traumatic stress. You want to, right? But I think to your point that you're bringing up, Mariana, the more adaptive strategies you develop for yourself, yes, the more able you're going to be to handle traumatic stress as it comes your way. But definitely many hits of serious traumatic stresses, it's not good for human psychology.
Mm-hmm. Thank you. Thank you, both of you. In your presentation at the beginning, Debra, you have showed the 3 stages, yes? What emotions we feel at different stages of the stressful situation. Like at the first, we can deal by ourselves, we just may not need others' help. At the second stage, where we are now, probably we can need the help of psychologists, yes? And the third stage, it may lead to trauma effects as well. And you have mentioned, I wanted you to repeat once more, what are the signs, what are the signals for us to know that this is time to go to the psychologist? Why I'm asking this, because still the culture of addressing psychologists in Ukraine desires better. I mean, it's still low. People are doing it, but not as much as it is necessary. We do not acknowledge that being psychologically healthy is as necessary as being physically healthy. So that is why I wanted you to emphasize once more, to your point of view, what are the signs that person cannot deal with the stressful situation by herself or himself and needs to ask for the help?
Sure. And so what I would say is, during that first period, psychologists and psychiatrists are not very helpful during the first couple days. Really what you're trying to do is just establish basic physical and emotional safety. And most people during that phase are going to have these kinds of trauma reactions because they're normal responses to an immediate threat. For example, when we look at women who have been sexually assaulted, about 96% of them have these kinds of responses that Daryn was talking about. That means it's normal to going through a severe stressor. Over the first 3 months, most people have those reactions go away, or at least come way down, really reduce. Okay, without ever needing to see a psychologist or psychiatrist. Things that predict people recovering are the kinds of strategies that Daryn and I have been talking about. Feeling like you can cope, engaging social supports, not avoiding the reactions and the feelings that it brings up. That seems to predict people doing better. Okay. Now, in that last phase, say it's been 4 months after a big stressor, a trauma, if someone is still having those kinds of trauma reactions or very high levels of anxiety, depression, they are feeling depressed or down most of the day, pretty much every day. It's interfering with their ability to work. It's interfering with their ability to take care of their family. Those are signs that the person may need additional help. It doesn't have to be from a psychologist or psychiatrist. It could be from a mental health professional. It could be from their physician. It could be from using some of these strategies and seeing if things improve. People improve in contexts where there are no psychologists or psychiatrists. Okay, so it doesn't mean that you have to see someone, but it can make things get better faster.
Thank you. Thank you. We have the question in the chat, whether it is possible that the person in the hard time demonstrates high level of resilience, but when the situation gets better, the person feels worse and the resilience also goes down.
Yeah, that can certainly happen. Some of us do really well in a crisis, and then after everyone is taken care of, we let ourselves fall apart. Right. Mm-hmm. Yeah. That can happen. And what I would say is, again, go back to those skills. Go back to those skills.
Yeah, thank you. Thank you. And one more question, which I wanted to ask, that's been resilient enough by yourself, how to make a team more resilient, which you work with? If so, if you are able to build, to foster this resilience, how can you help the people who are around you to increase their level of resilience?
I mean, I think that some of the slides covered that, and we talked a little bit about it, but it's really about, you know, allowing the people in your team, so, you know, work team for sure, but, you know, even in your district community, your family, allowing people to show their emotions, talk about their emotions, and encouraging them to follow the, you know, some of the strategies that Debra's slides laid out. You know, so you're taking very good care of yourself, but then you're aware, you know, that your uncle's drinking too much, you know, and you're watching other people adapt poorly, you know, coaching them a little bit on how to use these strategies, and also bringing them into a community of people that can talk about things. In a work setting, I think, you know, allowing, understanding the psychology reactions that are likely, and then supporting people as they go through it. And then, you know, applying some of the strategies that we talked about in this, you know, not just to oneself, but to your group, making it available, making it understood. And then maybe a little bit of, you know, giving people a little bit of space to actually have these reactions. You know, one of the team leaders in a group that I work with here in San Jose is a big proponent of, you know, mental wellness in our team. And, you know, I really watch how that team thrives compared to other teams that don't have such a supportive boss. He's a good boss, efficient boss, he makes people do work, but he also lets them have the space to take care of what needs to be taken care of. And then it really is the most healthy team I work with in all the work I do in different teams here in California.
Yes, thank you. Thank you, Daryn. Thank you. Thank you for your time, and thank you for your questions. We would definitely ask you more, but unfortunately our time is over, so we have to be punctual and to let you do some other things. And we have some food for thought after your presentation and after your ideas. So we do appreciate the involvement of Stanford in the project. We do appreciate the involvement of Stanford Medical Health Education, and you personally, Debra and Daryn, for sharing your experience. Thank you. Thank you.
Well, thank you very much for inviting us. I think that we were able to pull off something that can be very, very useful for folks, and I'm proud to be a part of it. Thank you.
Yeah, let's stay in touch.